The following is a demonstration of a tool for performing very powerful clinical research. Now, one of the challenges in performing clinical research is querying patient data. For example, if you wanted to do a clinical trial, the bulk of your time and associated cost is associated with finding qualified patients. Now, let's consider some of the IT challenges behind all of that. First of all, you're dealing with data from these very complex electronic healthcare record systems that potentially entail the use of tens of thousands of underlying database tables. So in performing and writing these queries, you have to know the names of these tables and corresponding columns in these tables. You got to have IT skills to be able to write SQL queries. You need to be able to have knowledge of appropriate code sets. For example, if you were doing a clinical trial involving patients with heart disease, you got to know the codes all associated with the various kinds of heart diseases. Now imagine for a minute that there were the ability to work at a higher level of abstraction, where you didn't have to know the underlying details I just described. Where, for example, you could take a clinical trial specification and look at the various conditions and automatically generate the necessary queries to find qualified patients. That's exactly what you're going to see in this demonstration. And in this demonstration, it illustrates many of the concepts described on this website. The notion of something called a soft schema, the use of ontologies that provide the ability to morph an information system into a knowledge system, the ability to do very powerful graph queries, the ability to automatically generate necessary code sets. The big bold claim here is that as a result of utilizing these underlying concepts is a tool that provides the ability to potentially reduce the amount of time and corresponding cost associated with something like a clinical trial by maybe 3 orders of magnitude. So if this had cost you tens or even hundreds of thousands of dollars, imagine being able to do it for hundreds of dollars.
This is a brief and informal demo of how the StarMaker tool from Park Street could be used to find candidates for a clinical trial. We'll start from the clinicaltrials.gov site. For this example, it'll be best to use an advanced search. Let's focus on myocardial infarction. What we can also do is look only for open studies and restrict ourselves to observational studies, which are more appropriate for this sort of tool, of course. If we obtain a list of such studies, I've already been through this once, so I know that there's a good one here, which is number 3, angiogenesis and fibrosis in myocardial infarction. So I'm going to select that study and scroll down a bit to look at the details of the selection criteria for patients in the cohort for this study. As you can see, the idea is that we want patients 40 years of age who've sustained a large acute myocardial infarction, that defined by obviously a diagnosis of AMI and a high troponin reading. So let's begin to build that query in StarMaker. The logic of StarMaker involves a collection of tools on this left-hand side that I can drag to form include or exclude criteria. And so, for example, if I'm looking for visits that included a diagnosis of acute myocardial infarction, I might begin by finding in my tree of ICD-9 diagnoses the acute myocardial infarction category. There are, as you can see, a number of subcategories and sub-subcategories, but in StarMaker, by choosing the major categories, we'll obtain patients with any diagnosis anywhere within the collection of AMI diagnoses. We can, anytime, we can run a count to find the number of patients in the entire database who've had that diagnosis. In this case, this is a large test database from an academic medical center with about 23,000 patients, or visits I should say, in which that diagnosis has been rendered. But in this case, we're after, in specific, those visits with a high troponin level. So what I've done is dragged the labs tool, and I can simply say troponin. As I start to spell that out, you'll see that the system responds by giving me a list of matching lab result categories. And eventually we'll use troponin T. I happen to know that there's a large number of results in that category. Let's look for those where there was any troponin T value greater than 10, which is the logic of this study. As you can see, when I add that condition to the list, I now have a much smaller cohort. We have only 91 patients who met those two criteria. And we're expected to restrict age to 40 or greater. I can drag the sex and age at visit tool, ask for 40 or greater, and now the total number of patients in the group drops down to 81. We do have some exclusion criteria as well. If we go back to clinicaltrials.gov, you'll see that we're, for example, to exclude any patient with a GFR reading of 25 or less. And it's not clear here what that means. Does that mean that the average GFR for a particular visit is 25 or less? That all GFRs were 25 or less? Since we're looking for failure, what I think we might do is specify that all GFRs ought to be that low. So we can go back to laboratory results, drag it here to form an exclude. We'll type GFR, and we'll look for those where all GFR readings are less than 25. By excluding that group, you can see that the cohort has now dropped a little further to 68 patients. We've also been asked to avoid those patients with a diagnosis of atrial fibrillation. We can find that by excluding. And I'm not sure exactly where I might find atrial fibrillation in the entire scheme of ICD-9. So at any time I can use text search and just type atrial fibrillation and select the associated item. And so I've created another exclusion for atrial fibrillation patients. I can check now to see the number that remains in my cohort. We're down to 60. As one final criterion, we probably don't want patients selected for this study who didn't survive their AMI. And so let's do one more thing. Let's add an exclusion here, this time for a discharge disposition of deceased. And now we can see that we're down to just 44 patients who meet the final criteria. We can at any time, rather than counting the number of patients, run a profile to get some sense of the nature of this cohort. So we can see the age distribution, sex, physical location, race and religion. These may well not be relevant to a particular study we're doing, but in other cases they may be quite relevant. The last bit, which of course I won't demonstrate because it would involve disclosing private health information, would be assuming that IRB approval were obtained, you would surely want to get identifying information for these patients and visits. And so it would be an easy matter for me, if I had the right, to add patient data, such as MRN, name, and date of birth, to output, which I can then produce in a form that downloads directly into Excel. And so I think the logic of the use of StarMaker in terms of specifying criteria for patient selection, specifying exclusions, and eventually describing the output data that's wanted should be clear and obvious. And certainly here in 3 minutes, we've managed to get a pretty good starting point for the cohort that we would utilize for this study. So thank you very much for your time.